Mommytrack Daddy Whispers Podcast is now called Birth Agni Podcast.
Hi there. How are you? Good morning or good evening, whatever time of the day that you're listening to me. Thinking how the day is gonna be all along or prepping up for the night. If you are later into the pregnancy, you would have figured out some stretch marks by now. And if you are early on, you must be rejoicing that, hey, there are no stretch marks. I was 6 months pregnant and pretty sure that with all the water intake and gradual belly gain and applying coconut oil on my belly, there will be no stretch marks. But one day, when I looked at myself in the mirror, I saw the lower part of my belly and I was like, what? The otherwise not visible lower part of my belly, because of the belly obstruction itself, had some dark red stretch marks and I freaked out. I told my husband, you would have seen it. You should have informed me. So, when do you actually get stretch marks in your pregnancy? My name is Divya and you're listening to Mommytrack Daddy Whispers Podcast, BITESIZE-Pregnancy series, where we discuss the major parts of pregnancy so that you are able to make informed decisions throughout it. And talking about my expectations with my husband, unrealistic expectations. So when you get your stretch marks, you get your stretch marks later in the pregnancy and not early on. When, all the ads on the internet from your phone start spying at you and, they start bombarding at you. No, that's not when you get your stretch marks. You get them later in your pregnancy. And if you are a partner who's listening to this podcast right now, actually, if you do spot a stretch mark, there's such a hype and an added burden, you should tell your partner. And in this episode, we'll walk you through what are stretch marks, what are the probable causes, what are the treatments that are available, and what study and research says about them. So what are stretch marks? I was like you, worried too. I did think of buying some ointments, the ones that have cocoa butter, shea butter, and all of, the collagen and the elastin stuff in there. But then my doctor said, stick to coconut oil, massage your belly, and you should be fine. So I was okay with coconut oil. But I was able to still get some stretch marks. Now, stretch marks are a physiological change that happens in your pregnancy. Physiological meaning how a part of your body works or how an organ works. And all of it is affected by how your brain functions. So stretch marks are usually caused by stretch in your skin. And when that stretch is accelerated, it happens at a speed that the skin, the largest organ of your body, is not able to cope up with it. And stretch marks, the underlying cause can also be hormonal changes. So a lot of us women have stretch marks and they can happen at the time of puberty when there is a sudden weight gain. And it happens at pregnancy when there is a sudden weight gain due to the hormonal surges. It depends on your hierarchy, on your genes, if your mother had it, the type of skin you have. It depends on so many factors whether you will have stretch marks or not. But research and study says that 50 to 90% of women get some stretch marks during pregnancy. So on an average, 7 out of 10 women get stretch marks in pregnancy, and that's a relief. You're not alone. Everybody gets it. Almost everybody gets it to some degree. So why is there such a fuss around stretch marks? And should you be worried? Should you be worried? First of all, of course, stretch marks in pregnancy can be definitive, can look very weird, red, scary. They're far more visible in pregnancy. And it is something that is marketed with the need to be fixed. Oh my God, you have stretch marks, you should not have it. Let's fix it, it's a problem. That's how, when somebody wants to sell you something, they're going to market it as something that shouldn't be there, something that needs to be fixed. So we all look at stretch marks as a beauty problem. Stretch marks are scars. They're actually scars that are there because the skin could not cope up, like I said, with the accelerated gain, with the accelerated stretch to accommodate the growth of the baby. And now we will talk about some studies. What do they say? And how useful these ointments are to work at your stretch marks. Should you be worried? Let's answer that first. Have you ever noticed the fuss about stretch marks in postpartum as much as it is in pregnancy? This question will answer this for you. It happens as if the entire advertising industry after the baby is delivered is fixated, on the baby. They forgot about you. Why? Because your consuming power is now attached to the baby. Now you can spend tons of money on buying products for the baby. Why be worried about you? Have you ever noticed that? I mean, you will notice that since you are expecting right now, you will see the change in the way things are presented to you as soon as the baby is born. But if you have had people around you who were pregnant and they delivered, you would almost, with all of the people, not talk about stretch marks after the baby is delivered. One of the reasons is, of course, that, once the baby comes in, the priority becomes the baby and you're so involved, you forget about your stretch marks. Now, even if you had them, despite using the ointments or not using the ointments, they are going to fade away in color. They're going to be there. The skin is going to change. It's going to shrink with all the work that you're going to do. Your body will try to resume normal function. And the stretch marks will normally fade away to a silvery line. They're going to be hardly visible. And trust me, after some time, you wouldn't even give an iota of stress over it. So for the advertising after you've delivered, it is like the tangent that actually goes to the other side of the circle to your baby. And stretch marks, although they are there, they hold very little significance because your consumption power, like I said, has gone to the baby. Bingo. We'll now go on to what the study says about the use of these ointments, whether they help you reduce stretch marks in pregnancy or not. A review of the Cochrane database system says that we found no high-quality evidence to support the use of any of the topical preparations meaning ointments. In addition, it is important that preparations commonly used by women to prevent and treat stretch marks are evaluated within the context of robust, methodological, rigorous, and adequately powered randomized trials. Randomized trials is a term used in study to tell you the number of people that were picked up, and they were random. Another study says that overall there is a distinct lack of evidence for each topical formulation. The majority of topicals, that is ointments, failed to mention their effect on early versus later stages of stretch marks and their role in both prevention and treatment. In conclusion, there is no topical formulation which is shown to be most effective in eradicating or improving stretch marks. I studied over 11 research papers or reviews, etc. And all of them said the same thing. So according to me, there is no fuss about stretch marks. You should not be worried. They will look weird, ugly, because the skin is stretched and you're able to see the blood vessels under them. Oh my God, the amount of blood your body is producing to accommodate the baby. It's working so hard. You can see that through those stretch marks. You can see the body prepping up for the baby through those stretch marks. Now, I know I've put you in a quandary. You're like, I'm worried still. I see that you've given me all that information. You've told me so many things, Divya, but I'm still worried. Can I keep using those ointments? Of course. It's up to you. Make sure that, you're taking the right ones. You can use your traditional oils that are used in most cultures to maintain the moisturizing effect of your skin so that it is able to stretch as much. Know that nothing can actually predict that whether you'll have it or not, because there are so many factors involved: the hormone levels, your genes, the amount of work that your skin is doing, your body is doing, etc., etc. But you can definitely try and feel good. Massaging will make you feel good. It's therapeutic. You should do it. You should drink a lot of water too, because the more the skin is hydrated, all the oil, all the shea butter, they're all moisturizing agents. All at the end of the day they're going to do to your skin is provide you moisture. So provide moisture from within. So drink lots of water, fluids in your pregnancy. And if you're able to do that, you should be able to manage pretty much the stretch marks that can be managed. Other than that is not in your control. And here is an activity, I know you're worried and I know you're not satisfied as much. You may not be satisfied as much. I tried my best. So here is an activity at the end of the episode for you to do. Go to your friends who've had deliveries. Talk to them about their, experience of using ointments and what was the result and what happened later in postpartum. Talk to your mothers, talk to your fellow friends, etc. and gather your own results. And then tell me what you figured out. So that's how it is. But this is something that you should definitely do. Talk to your friends, talk to your, mothers, fellas, and ask how their experience have been, and you will know firsthand what you should do and whether you should or should not be worried. On that note, I will say bye-bye. Take care. You are beautiful. You are glowing. That's a lie. We are always thinking, oh my God, I look so dull in pregnancy. A lot of us can look dull in pregnancy. That's all right. But you are glowing from within. You are enjoying this phase. If you are later into the pregnancy, you've developed, or you're thinking, oh, I have not developed stretch marks because I'm earlier on in my pregnancy. I hope all of this helps. If you like listening to me, do subscribe, follow. Tell me what more do you want to listen to. I will definitely try and bring the best of topics that I know of, that the listeners, come back and tell me, that you come back and tell me. Talk to your friends, share this episode with them, share the podcast if you like. And remember, your body is powerful. It has stretched. It has worked so hard to create a human being out of almost nothing. And you are powerful. You have the strength. You are beautiful. And you got the bar. Stay tuned.